Hi, I'm Natalie Perlov. I'm a third year at the Sidney Kimmel Medical College, and today I'm here to talk to you about the importance of the role of deaf education in the health world. I studied neuroscience and linguistics in college, and part of that was motivated by the fact that my parents are both immigrants, and that kind of inspired this question in me of how do we process language? Is it innate? Is it something learned? Part of my inspiration for starting deaf education and awareness for medical students, also known as DeafMed, is when I was taking American Sign Language classes, I would talk to deaf people about their experiences in healthcare, and they always talked about the miscommunications that arose and how uncomfortable it was for them. I realized there are so many misconceptions that we as hearing people have about the deaf community. There are kind of, two different camps. There's big D deaf and there's little d deaf. So big D deaf is I can't hear and I'm culturally deaf. So I use American Sign Language as my primary language modality. Little d deaf is I can't hear, but I'm not necessarily culturally deaf, and I wouldn't necessarily identify as deaf. Something that really blew my mind is there is no written equivalent of American Sign Language. And so think about when you go to the doctor and they say, okay, you've got diabetes, here's a pamphlet. So oftentimes deaf individuals' health literacy is lower because they don't have those resources available to them. And you see that actually play out in their health outcomes compared to hearing counterparts. What it's doing right now is I'm hoping is an effective introduction to deaf culture and American Sign Language. And whether it's, thinking a little bit more carefully about if you have a deaf patient, are you knocking on the door, or maybe you flipping the light switch to alert your presence? Are you, interacting with them and the interpreter in an appropriate and polite manner as opposed to talking about them in the third person? Just those little changes, I think, really help bolster the physician-patient relationship. In terms of how I hope it helps patients, again, I just think having people recognize their culture and the issues that they face is really affirming and hopefully is a step in the right direction.